Welcome to the latest MS Hear from the Experts webinar. These webinars help people better understand multiple sclerosis, highlight MS-related resources, plus provide tools and tips to navigate their MS journey with more knowledge and confidence. Thank you for joining us for today's webinar. I'm Shauna McKinnon, and I'm your moderator for today's broadcast. I've had MS for 28 years, and I'm a longtime volunteer with MS Canada and previously MS Society for actually 28 years. MS Canada would like to acknowledge that we are on the unceded and ancestral territory of First Nations, Inuit, and Métis people across Canada. These nations have cared for this land from the oceans to the mountain peaks for thousands of years and continue to do so today. We thank them for their continuous care and for the opportunity to host this session today. At MS Canada, we are committed to learning from and working with Indigenous peoples to care for the land that we all call home. We'd like to thank Beatrice for their generous support of this webinar and their commitment to advancing education and awareness for Canadians affected by MS. Before we get started with our presentations, let's briefly go over a couple of housekeeping items. Your microphones have been muted. This session is being recorded and will be available soon on our website from the informative videos on MS page. A Facebook Live recording will also be available. If you have a question, you can type it into the chat box and we will try to get to as many questions as possible following the presentation. We kindly ask that your questions be general in nature so that everyone can benefit from the discussion. If your question is personal or specific to your own situation, we recommend following up directly with your healthcare team or our MS Knowledge Network. Please note that MS Canada does not approve, endorse, or recommend any specific product, therapy, or service, but instead provides information to assist individuals in making their own health and wellness decisions. Plus, the views and opinions expressed in the presentations are those of the speakers and may not necessarily reflect the views or positions of MS Canada. Please note that during this broadcast, a couple of pop-up polls will appear. We ask that you respond to each of them. The anonymous information will help MS Canada better understand your experience and the impact we are having on the MS community. I'm very pleased to introduce today's expert, Dr. Sarah Donkers. Dr. Donkers worked clinically as a physiotherapist specialized in neurological rehabilitation, and it was her clinical experience with people with MS that led to her research and her PhD. She is trained and worked clinically in both Canada and Australia. She has dedicated her career to improving the access to and quality of neurological rehabilitation. The focus of her research is to better understand how we can optimize functional recovery through neurorehabilitation and how we can get such approaches into routine care, bridging neurorehabilitation interventional research with implementation science and health services. Sarah is currently a professor in the College of Medicine, University of Saskatchewan. She teaches the neurology content in the School of Rehabilitation Science. She was honored as the 2024 recipient of the university's Outstanding New Researcher Award, selected for her research contributions and impact in neurorehabilitations. Welcome, Dr. Donkers.
Thank you, Shauna. That was a mouthful. Sorry. Thanks for having me. So as Shauna said, I'm Sarah Donkers. I do get to live, work, learn, and play in sunny Saskatoon, Saskatchewan. So I'm based at the University of Saskatchewan, but I get to work with amazing researchers from across Canada on a number of different initiatives and research projects, all of which to try and advance our understanding of MS and the role that rehabilitation and recovery play in living well with multiple sclerosis. So I'm honored to be here today to talk about one of my favorite topics, MS rehabilitation. In brief, what I hope to cover today, or aim to cover today, is what is rehabilitation and from a definition but a scope standpoint. So when we use that term, what do we actually mean? We'll spend some time talking about the core components, or what I refer to as the core components of rehabilitation. And this is an interacting, overlapping look at skills-based functional training, symptom management, and brain health behaviors. I'll spend a little bit of time talking about tasks and sort of the range of what I refer to as the functional continuum or the functional mobility continuum. And when we talk about tasks, how it's important for us to consider various features of the task and the environment we're performing them in order to continue to challenge our functional skills and optimize rehabilitation training efforts. And then we'll end with some tips for supporting ongoing rehabilitation that you guys can do at home. And of course, time for questions. So what is rehabilitation? AKA rehab. You might hear me use that term, rehab. And that's just a way to shorten rehabilitation. So often I'll say, oh, I work in neuro rehab, or I work in the Department of Rehab Science. But really, we're using rehab and rehabilitation interchangeably. I always like to start with a definition, just to make sure we're all talking about the same thing. So I want to pause here and give you a second to think, what does rehabilitation mean to you? So I'll tell you that there is a challenge with the word rehabilitation, as it's used to refer to many different things in many different settings. For example, some people might talk about rehabilitation as a location. So maybe you were in a rehabilitation hospital or ward or a clinic. Sometimes people are using rehabilitation in the terms of a profession. I'm a rehabilitation provider. And as I said, I work in a School of Rehabilitation Science. There's several different types of rehab providers, physiotherapists, occupational therapists, for example. Rehabilitation could also refer to a type of intervention like cognitive rehab, vocational rehab, or I want to encourage us all to think about rehabilitation more as a process. So rehabilitation is an ongoing process that is used to try and maximize independence, help people adapt to changes in functional abilities, manage symptoms, and support overall brain health and wellness. So from a definition level, the World Health Organization supports that idea of thinking about rehabilitation as a process. So it's saying neurological rehabilitation specifically is goal-directed and a problem-solving process that is aimed at optimizing function, reducing disability, and enhancing well-being. Really, there's a whole range of different interventions that can be packaged together to find a rehab program that's right for you. But really, the intervention should be about maximizing your independence so that you can continue to participate in meaningful life tasks. And when I say independence, I don't mean without equipment. I mean in ways that allow you to do the things you love to do, but maybe finding new ways to do that. And often that requires using things like adaptive and assisted technology. Those tools, however, research shows us are best implemented if they come with training. So when we're trying to maximize independence, it is this individualized process of being like, what are your goals? How do you currently do them, if you're able to? What are some ways we can work together to develop skills and integrate equipment if it's needed to allow you to continue to participate in your meaningful life tasks? So at the end of the day, it's really about building skills to meet your goals and defining and moving towards the activities that optimize quality of life based on who you are as an individual. So I mentioned already, there are several types of rehabilitation providers, and rehabilitation providers work in many different settings. So sometimes in rehabilitation hospitals, but sometimes in private practice, or they're in the community, or they can come to your home. And really, all rehabilitation providers have this intention of trying to support you to function better in your home, in your work or your daily activities, or in the community. So in MS, there is evidence to show that rehabilitation should ideally include a multidisciplinary team. You don't have to see everybody all at once, but there might be different members of the team you see for different components of your care. So some type of providers include physiotherapists, which are also known as physical therapists. There's occupational therapists. There are physiatrists, which are special types of doctors, physicians who have specialized in physical medicine and rehabilitation. Ideally, you can have access to psychologists, like clinical psychologists and neuropsychologists. Social workers may play a role at certain parts in your life or to help meet certain goals. Less commonly, but also important in MS care, we need to be aware that there are speech language therapists who can help with communication, but also swallowing concerns if the muscles of your mouth and throat are affected, or if the parts of your brain that control communication and language are affected. There's also respiratory therapists that can help with our breathing muscles, but also if you have MS and another condition like COPD. There's recreational therapists, exercise therapists, and rehabilitation assistants. And ideally, and for the most part, there is a variety of these individuals working in places like publicly funded rehabilitation hospitals so that we can individualize care and get certain people with MS into the most appropriate person they need to see at any given time. I mentioned there's also different types of rehabilitation interventions. So you might go for a certain bout or number of sessions specifically for cognitive rehabilitation. Maybe if you're looking at returning to work or modifying your work duties, you might get a bout of occupational rehabilitation or vocational rehabilitation. Occupational therapists or occupational rehab also help a lot with driving and adaptive driving, activities of daily living, so adaptive equipment that can allow you to still find ways to cook or help with dressing, bathing, showering. You might have physical rehabilitation, recreational rehabilitation, or there may be specific programs, right? So you may need a bout of pelvic floor rehab. So we know bowel and bladder concerns are a possibility in MS, and there's specific type of rehab to help with the pelvic floor and managing those concerns. There's also musculoskeletal rehabilitation, and I put that in there because it's important to remember not everything is MS related. So even if you have MS, you could still also need a hip replacement surgery. And you might then have to go into more of a musculoskeletal rehab or surgery recovery program. And hopefully they are also keeping your MS functional goals in mind. So coming back to this idea of rehab as a process, I want to emphasize it's ongoing, right? So there's many different components. This doesn't mean that you have to be seeing a rehabilitation provider throughout your entire life, but there's different components and different things you can be doing at any given time in terms of seeing a specific provider. You may need that if you have different aims, such as falls prevention. That would be a good time to see maybe a physical therapist to work on balance training and falls prevention and look at what sort of supports you might need in your home to get around more safely and what sort of exercise program that is best for you to maintain your balance or to safely challenge your balance. Other times could be maybe you were sick, right? So say you had the flu or pneumonia, and there was a period of time where you were not able to move around or get around as much as you typically do. So what we can see often in MS is other sicknesses and periods of sedentary behavior can make it harder for us to move the way we used to. And it's not that you've lost those abilities because of new neurological deficits. It's a deconditioning often and a lack of training. So, this is where rehabilitation can help you safely challenge yourself and find new ways or new approaches of doing things so that you don't keep losing function. Rehabilitation is often referred to as a complex intervention. And so that's perfect for MS, right? MS is often referred to as a complex condition. And I think that's because it can affect any part of the nervous system. It's very individual, it's very heterogeneous. There's no clear patterns of progression or timeline of progression. So people need different things at different times. And rehabilitation as a complex intervention means there's often multiple different interacting components. So we might pull in a certain piece of adaptive equipment and maybe some electrical stimulation and a certain exercise program to find the right rehabilitation intervention for a given person at a given time. Ideally, we want rehabilitation early and often, is what I say. So we don't want to wait until you're no longer able to do something. We don't want to wait until you critically need a piece of equipment. If you can think about investing in your movement repertoire and your skills early on, through practice and movement experience and developing skills, we have more movement capacity and potentially some influence over the rate of disability accumulation that could occur with MS. So you might need different bouts at different times, but it's never too late, but intervening early is ideal. I mentioned this idea of using equipment. So in rehab, this is sometimes referred to as compensation. And it's a really valuable part of rehabilitation in MS because we can't always get rid of symptoms, right? We can't always regain function in, say, our leg or our hand. But what we want to do is make sure that you can still find a way to participate in your meaningful life tasks. So we use a combination of compensation and restoration. So we find new ways of moving, but we still want to practice those movements. And that's where the restoration comes in. Restoration is about building capacity for movement. So you have maybe the endurance and the physical capacity and the skills and the balance and the confidence to be able to have different movement patterns for different environments. If we just give you a gait aid, say a walker or poles, and we don't practice training with those or implementing a walking program where you can build capacity, research shows us that's not as beneficial as just giving you a piece of equipment. So ideally, we want to find the best combination of compensation and restoration so that we can continue to expand your functional skills across a variety of tasks. So I talked about the core components of rehabilitation. So I think of them as functional training, symptom management, and brain health behaviors. So we don't have to do them all at once. Often we're focusing on different things. So if you've recently had a progression or maybe a change in abilities, this is where a short-term bout of functional training, so ideally a few times per week over a number of weeks, so you can actually invest in challenging task practice to develop new skills. That should be prioritized, right? Because we want to emphasize that function first approach. I mentioned that we can't always get rid of MS symptoms. Often we can't, but we help people develop skills to cope with their symptoms. Also, functional training and health-related lifestyle behaviors are some of the best things we have in the long term to support symptom management. So when it comes to symptom management, you want to prioritize those symptoms that are preventing you from meeting your goals, right? Or identifying the symptoms that are limiting you from the functional training, or maybe limiting you from certain brain health behaviors like sleep. And then you prioritize intervening at that symptom level when it's limiting you from those other things. I will say, if you're ever getting an intervention at the symptom level, so let's say a brace for your foot drop, or maybe a Botox injection for some spasticity, research shows that those symptom level interventions have the biggest impact when you pair them with functional training. So if we get any improvement in our ability to move, like our range of motion or supported movement through a brace, we want to then practice that in the functional skills and in the environmental contexts that we want to use those new ranges in. And then brain health behaviors. When I always think there's so many things we can do that are great for everyone, with or without MS. But we can't do it all the time. And so there's a number of different brain health behaviors that you can choose to prioritize at a given time or on a given day. And focusing on those after maybe a bout of functional training, or if you are doing most of the things you like, you're able to participate in most of the things you like, then that's when you can focus on things like general physical activity and exercise, or cognitively challenging tasks for cognitive enrichment, to really invest in that brain health behavior. So MS rehabilitation typically includes an individualized combination of functional training, symptom management, and brain health behaviors. So zoning in a little more on that functional training, it should be goal directed, right? It's because there's a certain amount of training that needs to come, and there's specificity in our training. So it's just like practice. If you want to develop a skill, you have to find ways to practice the components of this skill, and you need to continue to challenge that practice in order to make improvements. There are so many functions in the world, right? It's not like we have to spend our days practicing every single functional skill. This is where the goals come in. What's meaningful to you? What are you having challenges with? But also in that context, what can potentially be modified? And that's where we look at, do we need equipment? Do we need to look at a new strategy for training this? Do we just need some practice and some capacity building, like some strength training and aerobic? Do we have to manage fatigue before we can start engaging in that level of practice? So it really is an individualized approach. But overall, it should emphasize active engagement. So you being involved, not you going to a place and just getting a passive treatment, like someone else stretching you. That can have benefit at the right place and time, but that's not going to have the functional carryover you need. So it's not going to have the functional carryover that we want, and that's why we need active engagement. And I'm just going to move on to, sorry, this is really busy. I wanted to layer the information in, but I'll just orient you to the slide. So if we start at the top of the slide, you see a blue line, and it says there is a range and types of mobility tasks. So these mobility tasks are sort of like our base functional positions that allow us to do a number of things to interact with our community. And this is not an exhaustive list, but I like to point out the whole range. So there's things like bed mobility. And there's lots of fun things you can do without even getting out of bed, such as bridging or practicing rolling or rolling onto your stomach and practicing planks. So there's lots of potential movements, but also training that can be done even if you're not able to get yourself out of bed, or even if you're not able to independently stand. If you're feeling dizzy or having balance concerns, these positions are a good example of ways to keep moving in a safe position. There's also floor mobility and transfers. So, this idea of getting on and off the floor and finding many different ways of getting on and off the floor. I've worked with a number of people with MS who are like, "Ooh, I haven't even tried to get on the floor for ages." And I'm like, "Well, why?" And they default to saying, "Because I don't think I could get up." And in some cases, that is absolutely true, but not in all cases. It's just they didn't have the skill or the confidence or the opportunity to practice it. And maybe they haven't done it with leg spasticity or hip weakness. And so we can actually work on developing a new strategy for that movement. So I'm just putting ideas out there in all these different positions. You can practice different functional movements. So there's kneeling and half kneeling, 4-point kneeling, so like on hands and knees. There's sitting. You can challenge your balance in sitting and your weight shift. There's lots of functions that happen in sitting, right? Getting dressed, brushing our hair, brushing our teeth, playing cards, working, sewing, knitting, coloring, washing dishes. So all of these, although there's a base functional component, there's many of skills that can be layered onto it. So we have upper limb movement. Then we can talk about transfers like sit to stand. In standing, we can progress to things like balance, challenging our balance, walking, and walking for many different reasons, maybe short distances with a walker, and building towards longer distances. Maybe there's walking with carrying objects, or being up and about for other reasons like dancing, one of my favorite activities. And of course, the list goes on and on. So this is to show all the different base skills or base tasks, mobility tasks that are associated with a skill. So that's where we pop down to this next level. It's about more than just movement, right? It's about, well, why are we doing this movement? What are the goals and what settings do I need to do this? Because that's where we have to layer on details of practicing the full skill. So yes, maybe you can sit. Yes, maybe you can reach. But can you do those two things at the same time when you're tired in order to feed yourself or carry a cup of hot coffee? And the reason I'm pointing this out is if we focus on goals, we can then break down the environments or the components of the task, of the overall skill that we can build into a rehabilitation program. Exercise is great, and it's one important component of rehabilitation, but our brain actually learns in movement patterns, and it stores in our brain skilled movement. So if I were just doing bicep curls, right, like a structured exercise for strengthening my arms, that doesn't necessarily mean I'm going to use that strength in tasks such as carrying objects or transferring myself. So functional task practice should have some specificity of the skills and the environment that you want to perform them in. So there's many different goals, right? I want to think bigger than just movement. It's why do we want to keep movement, and what skills are we building onto this baseline movement? Is it coordination? Is it planning? Do you need to follow a recipe? Do you need to be able to navigate busy spaces in order to grocery shop? Is there a safety element, such as using saws and hammers? So yeah, the list goes on, and we want to think broadly about social goals, recreational goals, physical goals, occupational goals. If we come down to the bottom left here, it says, consider the environment that the skill will be performed in. So some skills, we need them in our house. In our own homes, we have more control over what's called environmental features. So we can, for the most part, control where certain objects are. We can't control where kids or family members drop their objects that we might trip over later. But for the most part, the features of the environment are the same. However, when we're going to a grocery store or if we're traveling and staying in a hotel room, there's different features of the environment. And skills have an element of carryover, but they don't naturally carry over. And so to optimize rehabilitation, we want to make sure we practice a variety of skills in a variety of environments. And that's sort of where the right side comes in here. So consider different features of the task within an environment. So I mentioned maybe sit to stand, being able to get up from the kitchen chair might be a mobility task, but that getting up from sitting requires slightly different coordination and timing if you're getting up from a very low object or a very soft object, or maybe an object that moves like a wheelie chair. So I'm pointing this out because if you're doing certain exercises in your home or practicing certain mobility skills in your home, I want you to start to think, what are some tiny changes I can make to continue to challenge myself and encourage that rehabilitation process? So can you change features of the surface you're getting up and down from? Can you do it in a different way? So starting with your other foot, or maybe trying to use no hands if that's a safe option for you. In the bottom right, you see I also have a coffee mug, some hands, and then a brain. So I wanted to highlight that there's other ways to challenge a task. So we have our movement, right? So say it's an upper limb thing. Have you practice lifting things with low consequence? That's usually a good place to start, right? Like a pair of socks, something you don't really care if you drop, and moving up to something with more high consequence, like a slippery glass or a fragile glass or something that has hot in it. If you're working with the upper limbs, have you played with single limb tasks versus tasks that require two hands, like carrying an object, or opening in a jar where, although it's two hands, your hands are doing slightly different things. There's also object manipulation. So strengthening your hand is great, but do you have enough strength and coordination in that hand to do your goals, like knitting or writing? And then, of course, if we go back to the very top and we think about these mobility tasks, in order for us to use them for our everyday activities, there is an element of cognition, right? So we want to think there's the movement, but then there's also the planning and the dual tasking that comes with real life function. So this was meant to inspire you with all the different ways you can select a task and get curious yourself at home and play with different tasks. But then also for you to reflect on, okay, I may not be able to do this movement. What is it limiting me from doing? And are there other ways for me to do it? When we think about goals, really trying to get back to that, that context. Why do we want to do it, and in which environment? So jumping to brain health behaviors, there are a number of physical activity behaviors, there's a number of behaviors beyond physical activity that really help us support building brain structure and function. And one of the reasons we want to emphasize that in MS is so that we can optimize our brain health despite potential inflammatory attacks or disease progression. So we really want to invest in building a good brain structure, capacity, and functional connectivity. So we can do that by engaging in general physical activity. Last slide, I was talking about some task-specific training or functional training. General physical activity has lots of benefits, and really that's just about getting yourself moving so you don't lose muscle capacity or aerobic capacity. We also want to challenge the mind, so engaging in cognitively challenging tasks or cognitively enriching tasks like doing a puzzle. Nutrition plays a role in brain health. Being social, you don't have to be a social butterfly to benefit, but you also, if you're isolating yourself all the time and not navigating conversations or written communication with people, our brain is missing out on a lot of healthy experiences. Sleep is an important part of brain health, managing stress and overall emotional and psychological well-being, and then taking control over our general health. So I mentioned already, not everything is MS. And if we can optimize our other body systems, right? So maintaining a good blood pressure, a healthy body weight, being tested and screened for things like diabetes and high blood pressure, all of those have an impact on overall brain health, but also how we can compensate for multiple sclerosis. I mentioned already with symptoms that we want to prioritize functional training, but sometimes there's symptoms that are really limiting us from doing it. So let's say you can still walk, but maybe you can't walk as far because then you start getting foot drop and you're afraid of tripping. Or you're at risk of tripping, not just afraid of it. You're at risk of a falls. So we might need to go in and do something for that foot drop so that you can then continue to challenge yourself with walking and build capacity with your walking. So really try to prioritize addressing the symptoms that are preventing you from meeting your goals, and then try to focus on the functional training and the brain health, because research does show that they have an important role in long-term symptom management. I will encourage you to consider keeping a symptom diary, because I've worked with a lot of people where, you know, you experience something like pain or fatigue, and those are horrible symptoms. But sometimes when we experience horrible symptoms, our brain can't always figure out, well, is this making it better, worse, or actually not changing it? And so if you keep a diary, sometimes you can actually track patterns and learn, oh, I felt worse, but only for a short period of time afterwards. And now it's 3 weeks later and I'm getting better. So that can help be motivating, and also see patterns in symptom fluctuation. And it might also give you insight on when you might need to find a symptom first intervention before you can do your functional training. If you are engaging in functional training or exercise, the research is showing that taking rest breaks during your training and trying to schedule around any symptom fluctuations can help increase how hard you can train. So it can increase how hard you can challenge yourself. And it is safe to challenge yourself with MS. You might just need to take rest breaks and know that trying to do it in a temperature controlled environment, so a cool environment, or maybe using cooling devices like a cooling vest can actually help with overall symptom management and recovery. So where to start? I'm going to encourage you to start by focusing on your functional goals. So what are the goals that are most meaningful and relevant to your everyday life right now? There's things we can all think about that we want to do that we may never be able to do. So you want to get realistic and reflect on okay, I can't do this, but what is it impacting? Why can't I do that? Or how am I currently doing that? Where do I need to perform that goal and why? Getting to that level of detail can really help inform where to prioritize your rehabilitation training. So I just put some examples of goals in there that we heard from a recent research study we did. So we had people who came in and they're like, I really want to get on and off the floor. And I'm like, well, why? I think getting on and off the floor is great. You guys should all try it, right? If you're able to, try it a couple times a day. It's great for longevity. It's a great activity. If you're able to, try different ways of doing it. But in this situation, I was trying to dig into why do they want to get onto the floor? and they actually wanted to be able to play with their young children down there. Other goals include things like working in the garden, cooking, doing leisure time things like restarting a Zumba class, so going out into the community to attend a Zumba class. So you can see how these all would need certain individualized components in rehabilitation in order to get the best outcomes. So your goals will change, right? As we change, as individuals, as we age, but also as your MS potentially changes. So we want to reflect on our goals over time, and then reflect on our current abilities as well as the barriers and facilitators to that. All of this will take some self-management skills, and self-management skills can help with every element of MS, like remembering to take your medication, helping with resilience and mindset and coping. So just taking those opportunities to pause and reflect in on, what does your day look like, your week look like, or your month look like, and setting some goals, coming up with some action plans, engaging in problem solving. You don't have to do it all on your own. Having some way to monitor, progress or severity. And then, of course, having self-reflection, and ideally in rehab, you'll have a chance to get feedback and external monitoring from a therapist that you can work with. And I just put a link in here for my MS toolkit, and they have a number of really nice resources on setting goals, for example. Okay, we're getting close to the end here. So I just want to take a chance to talk about research. So I mentioned that there are a number of things we already know from the research about rehabilitation. And I will say that there is so much evidence to show how beneficial rehabilitation is for people with MS. There's so many beneficial outcomes, and it should be a part of routine care. So although research is still going on, we're trying to better understand things like how to improve access to rehabilitation, so all people with MS, regardless of where they live, can have the opportunity to train rehabilitation and be supported in that. There's also research looking at how do we best support certain brain health behaviors, like supporting physical activity behavior change, using psychological interventions, or sleep interventions. A lot of research in rehab now is looking at combining approaches. So maybe a medication with some functional training, or perhaps combining types of training like cognitive rehab with motor rehab. There's lots of research across every symptom, basically, for non-invasive neuromodulation. So we see different ranges of devices for different outcomes. But for example, there's repetitive transcranial magnetic stimulation being researched for depression and anxiety. There is different types of devices that are being researched to be paired with maybe cognitive rehabilitation or motor rehabilitation. And then overall, we're seeing more and more studies come out on technology and the role of technology, both as an adaptive and assisted device, right? Like smart braces, maybe electrical stim in braces. But we're also seeing computer-based programming and virtual reality. So this list was not to say these are the things you have to be doing. We talked already about what you should be doing: goal-directed, individualized, functional training, and brain health behaviors. This is just to show that research is being invested in, and every single study allows us to better understand a little bit more about how to support recovery and rehabilitation across the lifespan in MS. So what can you do now? I mentioned already, reflect on your goals, but also think what can be done outside of a rehabilitation session. So rehabilitation is a process. Yes, there's benefit from seeing providers and maybe doing certain bouts of rehabilitation, but there's lots you can do at home to continue benefiting or engaging in that rehabilitation process. So the examples I gave, just stay curious and play across the functional continuum. The other thing you can do is ask the healthcare providers you're currently seeing. So maybe your family doctor, your neurologist, maybe your MS nurse. You could ask them for a referral to a rehab provider, or if they think you would benefit from a referral. And I encourage you in those conversations to bring your own reflections. So what is your rationale? What are your goals? What are your symptoms limiting you from doing? Because that can help advocate for matching you to the right person with the right expertise at the right time to get that perfect rehab program for you. What you can do right now is also remember not everything is your MS. You might have shoulder pain and you can benefit just from seeing maybe a private practice physiotherapist or a chiropractor to just treat that shoulder pain, because it might just be musculoskeletal rotator cuff pain that has nothing to do with your MS. So I will leave you with some tips. I've sprinkled these throughout, but just to focus on them as we wrap up here. You don't have to do it all at once, and you actually can't do it all at once. So focus on your goals and focus on what matters to you at a given point in time, and just understand those will change. And you don't have to achieve your goals in order for that process of setting a goal to be beneficial. Please be kind to yourself. Rehabilitation takes effort. I gave you lots of tips, right? Or lots of information. These are all the brain health behaviors that we should be doing. And this is functional training and all the mobility skills that you could be doing. That is so much. And we can't fit it all in around around other things we have to do, like life and family obligations, which I know is part of life. So just please be kind to yourself. We all need a break sometimes. Get curious and play with functional training at home on your own. So think about, well, there's movements I can do, but what are some skills or challenges or different modifications to the environment or the task that can keep challenging my nervous system? Our brain really likes novelty and trying new things. Think about the whole range of brain health behaviors, not just physical activity. Prioritize intervening on a symptom early. So if it's limiting you from doing things, that's when you should talk to someone about it, because at the end of the day, it's about keeping you doing the things you love. And please ask for referrals, because we as researchers and healthcare providers are trying to advocate for access to rehab, but individual people with MS can also help with that advocacy journey, and I know you guys do. So in summary, MS rehabilitation is an ongoing process. It's driven by individualized, goal-directed decisions. It should reflect your current goals and priorities. Please continue to ask for rehab, because know that help is out there, and ideally you get access to rehabilitation providers in addition to any of the medical management for your MS. And just stay curious, because that act of questioning and challenging how else you might be able to do something or reflecting on things can really help build brain health on its own. So thank you for listening, and I think we have time for questions.
We do. So that's where I pop back in here. Thank you very much, Dr. Donkers. Really interesting again. And I've got to say, I really like the part about building confidence with the compensation and restoration, because I have met so many people living with MS over the past 28 years who do not have the confidence, and they don't want to try because they don't have that confidence. But once you try something, that's how you build the confidence to continue doing it or to try something else, right?
You bet. And it's actually failing at something is actually the best way for our brain to learn, right? We learn by making mistakes. And this is kind of what I meant by stay curious. If we try different ways of doing things, or if we try new skills, that's actually how our brain learns best. We build more synapses and more neuroplasticity through that. So confidence is important, but there's things we can do to build confidence and just safely trying, not being afraid to try, and knowing that you're learning in the failing process.
So go out and fail. It's a
Yeah,
win,
right?
basically. Okay, I really like that. Um, so, some questions that we have from people watching: what does success in neurorehabilitation realistically look like for somebody who is progressing? And I hate to assume or presume anything. I presume by progressing they mean with their MS.
Great question. I get asked that all the time, right? Often when we are um, training, we think, oh, we're going to improve our skills, or sorry, we're going to, gain new capacity. And in MS, maintaining a skill, improving ease of skill, and finding different ways to do a different task, even if it means using equipment or compensation, all of those are success. Um, Another way to look at it, though, is okay, maybe you're falling and you can do some balance training. It doesn't mean you're never going to fall again, but success could mean you haven't stopped moving and you haven't stopped doing the things you love because of your increased falls risk. You found new ways of safely doing it so that you don't miss out on engaging in your everyday life.
Okay. How can people with MS tell the difference between good soreness from exercise and versus overdoing it? And this is one I have difficulty with myself going to the gym. So,
Yeah. If it's a new movement that you haven't done in a while, you should expect to get some soreness. Um, if the soreness or the increase in symptoms, like fatigue or your foot drop gets worse, or you feel shaky, all of those are called like temporary or pseudo exacerbations, and they're to be expected after training. If they are limiting you from doing what you want the next day, you've maybe trained too hard. Um, and I think if you can't train again within that week, you've definitely trained too hard. Um, I will say that when you're starting a new program and learning new skills, typically the first 3 weeks means that you will feel more tired and you might need a nap in your day. It maybe means that there's not enough energy or capacity to do some of the other things, right? Like it's either you do your rehabilitation or you go grocery shopping. It doesn't mean doing rehabilitation should prevent you from grocery shopping if that's one of your goals or tasks. It's just know that it might be short lived while you're learning new things. But typically, after that 3 week period, you should be able to level out again.
okay, so don't do leg day 2 days in a row.
Absolutely not.
Are there any rehabilitation videos for free online that can be followed at home independently that you would recommend?
Oh, yes, there's many of great resources. MS Canada has a number of programs like the Time at Home and the NeuroSask program. There's YouTube videos. This one's a bit hard because it's like, how are you defining rehab? What's your current ability levels and what are your goals? But find something that you can safely do, is slightly challenging, that you enjoy doing, and that you will do because the routine and that habit of doing it over time is important.
Okay. How do you assess when to push versus when to accept that you may no longer be able to do a specific activity?
Awesome question. Awesome question. So you can always challenge yourself. The skill that you're challenging yourself with or the type of activity might change. And the reason I emphasize that is you maybe are walking, but now you can't walk as far and you're falling. It doesn't mean that that you can't get better or build better capacity at walking, or we can't build other skills like building capacity with using a wheelchair, or getting more skilled or more fit with using a wheelchair. So we can always build capacity within a skill if your way of doing things after a period of training. So these are the tough decisions we have to make as rehab providers when we work with people. You always want to try and build a skill. But if after those 3 weeks, they are getting more fatigued and we're not able to progress, that's where how someone's been doing the skill needs to be accommodated. Like we need to pivot. And we either pivot by focusing on different skills or focusing on different ways to do that skills. So it's hard. There's no clear answer. When you can no longer do something, you want to ask for help and maybe see OTs and PTs to find ways to still participate in that movement or that task, right? To allow you to have the independence in your life. And we still want to challenge you and find ways to train you, but they might just have different focuses.
Things start to look a little bit different over time, right?
Yeah, absolutely. It's hard too, but just because you have been given a challenge with a certain movement doesn't mean you should give up on what that movement has allowed you to do. We just have to look at it a different way, right? I can no longer stand up to put my pants on. You should still wear pants, maybe, right? You can wear a skirt, but we can find different ways of putting on your pants,
Okay.
right?
Okay. I'm going to kind of combine a couple of questions here. Somebody's asking about rehab being covered under OHIP, which is the Ontario Health Authority. Or insurance authority. So I'm suspecting it's going to be different for every province, right? How much is covered. So where do people go to find out that kind of information?
Great question. It is different, but by where you are in a province. And then there's certain components of rehab that are covered just through the publicly funded healthcare system, but you may not be able to access a person with those expertise. So MS Canada, again, the Navigator program, Navigator Network, has great resources to help answer those questions or connect you with the people to help answer those questions. But also, if you're affiliated with an MS clinic or a neurology clinic, they often know about local resources around that. So never hesitate to call your MS nurse and ask that. And they can maybe even put you in contact with local social workers. Yeah.
Okay, excellent. Now, mentioning the MS navigation leads me to wrap things up for the evening because we've come to the end of our time for questions. We could probably talk for another hour or two about this. I love this stuff. So as we wrap up today's broadcast, we want to remind everybody about how you can connect with the MS Knowledge Network, as Dr. Donkers has just mentioned. It is staffed by trained navigators who provide consistent, quality information and support. You can connect by phone or email or live chat through the MS Canada website. Navigators are available Monday to Friday from 8 a.m. to 8 p.m. Eastern Time, and they can provide assistance in both English and French. We want you to be part of the MS community and encourage you to get involved with our programs, services, events, government relations, and volunteer opportunities. Together we can take action to create a future free of MS. To find out how you can take action, check out our website, mscanada.ca. If you have questions about any of our education activities, please reach out to education@mscanada.ca or visit our website. On behalf of MS Canada, we thank you for joining us today. Good night.